Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Beta blockers. Beta blockers in heart failure. Beta blockers in heart failure. We use third generation beta blockers are used like carvedilol or carvedilol, or we can use nebivolol are the beta blockers which are used in congestive heart failure. We can also use cardioselective beta blockers are used in congestive heart failure, like metoprolol can be used or bisoprolol can be used for in congestive heart failure. So total four drugs are used in congestive heart failure which are beta blockers. In beta blockers like carvedilol, nebivolol, metoprolol and bisoprolol can be used in congestive heart failure. So all these four drugs will prevent the remodeling of the heart, and because they prevent the remodeling of the heart, they will decrease the mortality of the patient. And we can use them as an add-on therapy to angiotensin converting enzyme inhibitors or angiotensin receptor blockers, mainly during the stage 3 or stage B, actually stage B and stage C of congestive heart failure, according to the American Heart Association. Then these beta blockers are absolutely contraindicated for stage D of congestive heart failure. So they are mainly used as add-on therapy for stage B and stage D, and once the patient goes into advanced stages, then these beta blockers are contraindicated. Then these beta blockers they should be started at low doses. The beta blockers should be started at low dose and they should be gradually increased. And one more important thing is never stop the beta blockers suddenly, because if stopped suddenly, these beta blockers will cause if stopped suddenly, these beta blockers will result in some adverse effects, like if actually whenever you use beta blockers, the beta blockers will block the beta receptors, and slowly they will, so the body will need the action of beta receptors, so the body will produce more beta receptors, so actually there will be upregulation of beta receptors will be seen. Now due to the upregulation of beta receptors, if you stop the beta blocker suddenly, so the body will produce catecholamines naturally, so the natural catecholamines which are produced, these will block the they will act, sorry, these natural catecholamines will act on the beta receptors which were mainly produced by the blockade of beta receptors. First the beta receptors are blocked, first you are giving beta blockers. When you have given beta blockers, the beta blockers are blocking the beta receptors. The body senses that the beta receptors are blocked, and the body senses that we require beta receptors for normal activities, so body starts producing extra beta receptors, that is upregulation of beta receptors. Now you have suddenly stopped the beta blockers, the natural catecholamines which are present in our body will act on all the beta receptors, even the extra beta receptors, because now the natural catecholamines are acting on the extra beta receptors also. It will result in rebound hypertension or rebound stimulation of beta receptors will occur, resulting in side effects.
thank you and thank you for watching.